Hi everyone. So today we will be talking about whether or not the use of marijuana can lead to the development of schizophrenia. So, what is marijuana? Marijuana is a psychoactive drug that is used by many people, whether that be recreationally or medicinally, and many people use it, and it can be used to cause pleasure, relieve symptoms of any particular disorder or disease that patients have. All right, so what is schizophrenia? Schizophrenia is a psychological disorder in which patients have a hard time in distinguishing what is real and what is not real. And there's many symptoms of this that we will go over in the next couple of slides. So, when you ingest marijuana, some of the chemicals in it can pass through your blood-brain barrier and affect parts of your brain, and specifically we'll be looking at the cerebellum, which has to do with sensory skills, motor movement, and balance, and coordination, and all that fun stuff. And there is a link between people who smoke marijuana and the cerebellum, along with schizophrenic patients in the cerebellum. Now, schizophrenic patients, as I said just now, they also have their cerebellum affected, and we will see why that is in the next two slides. So, there was a study done in Germany in 1997, and it is showing that, as you can see, this very significant line that's increasing at the top is representative of cannabis used throughout age groups, and on the y-axis, the dependent variable is going to be cumulative hazard, which is represented as psychological disorder symptoms, and it shows that as people use cannabis, they also increase their chance of having psychological disorder symptoms. Now let's look at the symptoms of schizophrenia. There's positive and negative. Positive being the addition of something, and negative being the removal of something. So negative symptoms are lack of motivation, which is avolition, and lack of pleasure, and hedonia. And positive would be hallucinations and delusions, which are new experiences that the patient is having. And the reason why patients who ingest marijuana only experience positive symptoms is because the parts of the brain that have to do with pleasure and motivation are stimulated during marijuana inhalation. So that's why negative symptoms are not seen. And then also with schizophrenia, there are the AKT genes, which this chart is showing that people with this gene and smoke marijuana experience greater effects of psychological disorder symptoms of schizophrenia. And then these are just some general symptoms of drug-induced psychosis, anxiety, decrease in performance, etc. So those are many symptoms that people can have. And then the conclusion is just saying that it is possible that people who ingest marijuana can experience some short-term effects, and there are medications that can help with that.